My name is Andrew Hubbard. I'm the EPR Projects Delivery Manager for Royal Berkshire NHS Foundation Trust. Now, the NHS is full of acronyms, and EPR stands for the Electronic Patient Record System. So the documents we're talking about in this particular example are blood pathology requests, and they are vital to patient health, patient safety and patient care. The problem we faced at Royal Berkshire was not a financial problem, it was very much patient safety. We were requesting blood samples in the community with no way of digitally recording that back to pathology. What we had in the past was a handwritten form that was open to human error, being sent to pathology, being interpreted by an analyst, results being recorded, sent back, hopefully to the right patient, but no guarantee of that. So we have a unique system where the electronic patient record is hospital-wide. Anyone on the computer who has the right credentials can log into the patient record system, access the patient's record for healthcare reasons only, and are able to carry on with their duties. However, we use Cerner Millennium as our electronic patient record. So the Cerner security model says that you can't do remote printing, and that's what we really needed. We needed to be able to print digitally the barcode on the specimens and then send them to pathology. We initially approached Cerner and said, we have this problem, we want to be able to print remotely. Cerner came back and said, not a chance. We're not going to rewrite our security model, which is an international model, for one trust in the UK. We then talked to our printer supplier and said, we're using your barcode printers, can you help us with this problem? And over a 6-month period, we worked closely with them, had several meetings, we exposed our security model, and after 6 months they came back and said, we can't do this, we're really sorry. At that point, we were left scratching our heads thinking, where do we go now? We had a meeting with Cerner and said, this can't be a unique problem, you must have remote printing somewhere or some reason for printing off-site. They came back and said, we actually have a partner we work with called LRS, it might be worth talking to them. And that's when we approached you. So moving to this solution, the end user experience was greatly enhanced. We went from a handwritten request where there was the risk of human error and the risk to patient safety to a digital solution with the safeguards that we can put in place with a centralized global electronic patient record, a centralized pathology service, and the guarantee that the service is going to be matching exactly what we're requesting. When we were faced with this problem, we didn't ask enough questions, we didn't talk to enough people. The NHS is very insular, it's very siloed. You know, we work closely with other partners, but we don't share information. So don't be scared to ask your suppliers, ask other trusts what they're doing, and you will eventually get that answer. The relationship and the service we've had from LRS has been amazing, because when we initially rolled this out, there were problems. Our own security model was actually preventing the solution from working. We have dynamic IPs for a very good reason. However, the print solution wanted a static IP. And so we were actually ourselves preventing the solution from working. LRS worked very closely with ourselves and with our security team to come up with a model where we could overcome this using a very secure VPN method. And we cannot say how great their support was. Well, this is obviously an early stage of our relationship. You do managed print services, we have printers on the trust as well as remotely. So, you know, are there ways that we could do hybrid mail where we send things electronically or prints? Can we control all the prints within the hospital? So that a good example would be, if someone requests to print a patient record, can we prevent that if we think it's a misuse of the service? So we're part of the NHS, and we are not unique in this problem. Other healthcare services are going to be facing exactly the same problems. So I would say to them, look at what we've done at Royal Berkshire and then see about how it can be applied into your environment and improve your patient safety. They know what they're doing.